Assalamu alaikum, Iyakan Abdu Iyakan Astain. Welcome to my channel Dr. Shami Says. So in today's video I am gonna quickly go through the surgery 22nd August morning paper. So let's start. Question number 1. In hyperflexion of the neck, ligament injured is which of the following? The ligamentum nucci or nutch, whatever you may pronounce it as. The patient climbed the peak with a heavy bag on its shoulder after the developed loss of adduction of arm with loss of flexion at the elbow and loss of extension at the wrist. Most likely the damage occurs to which of the following? There is the upper part of brachial plexus. The injury to the shoulder result in extended medially rotated pronated arm due to the lesion of the upper trunk of the brachial plexus. The sensory supplied the medial 1.5 palmar and the dorsal hand is the another injury to the knee with the semiflexed femur move posteriorly cause damage to which ligament? That is the anterior cruciate ligament. The deep palmar arch is formed by the dorsalis pedis artery. The 50-year-old man known to have the hepatoma develops dependent edema with the dilated abdominal walls. The most likely structure involved would be the inferior vena cava. Next 8 IVC blocked up to esophagus vein dilation will be at the right ascending lumbar in the right subcostal vein. Next 9 the tragus and the helix of the external ear are derived from the first parenchymal arch. In appendicitis, the pen around the umbilicus pass through the sympathetic nerve at the T10. EEG of the patient shows no A waves because the patient is alert and the conscious. The female with the signs and symptoms of hyperprolactinoma was diagnosed with pituitary adenoma. The growth of this tumor anteriorly will compress which structures the optic nerve. The median episiotomy extended to the perineal body. If the perineal body cut, which muscle will be damaged? It is the bulbospongius and the superficial transverse perineal. The patient, the pH 7.55, partial composite 30 in the bicarbonate 21 disorder would be the respiratory alkalosis. The young boy sitting in a room with the sweating BP of 150/80, which of the following is the most likely cause? There is a mental stress. The 50-year-old man with a long history of alcoholism present. The severe epigastric pain, nausea, vomiting, fever, increase in the synovial appendicitis diagnosis. Superimpose the chronic pancreatitis was made in this case. The necrosis would be the fat necrosis. The patient presents ataxia on both closing eyes and the open eyes. The patient sway with open eyes and eyes closed. Leon would be at the cerebellum. The patient presented with the complaint of the unannounced voiding. He had been in the earthquake and crush injury of the spinal cord. His lower limbs were paralyzed. What is your diagnosis? That is the neurogenic bladder. The stab injury to the thigh with the nerve damage in the adductor canal is the femoral nerve. The patient the severe headache, vomiting, and the neck stiffness. Raised ICP on the lumbar puncture. There was blood strained CSF, that is the subarachnoid spacing. In the patient has the loss of fine touch pressure proprioception with the intact pen temperature sensation in the lower limbs related to the fasciculus gracilis. Next, the thiazide diuretics will cause the hypokalemia. The people consuming polished rice as their staple food are prone to the deficiency of the thiamine. 35-year-old man with the proliferative gastric ulcer complains of the pain in the stomach. It observed that the pain comes from the pituitary irritation of the gastric contents, the Lassac, which of the following nerves contains sensory nerve supply that conveys the sharp stabbing pain? That is the lower intercostal nerves. Ulcer in the posterior stomach valve with the collection of the Lassac cause irritation with sensation by the gluteus flanking nerves. In the medial most structure in the patuitary ligament will be the bile duct. Next 27 the surgical neck of the humerus fracture. There is a loss of the adduction the proximal upper arm lateral side sensations. The lost nerve damage would be the XD nerve injury after vasectomy. Rectus deferens ligated on the upper part of the scrotum ejaculate and after 2 months will contain the seminal and the prostatic fluid. The muscle of mastication not supplied the mandibular nerve. There is definitely the gastric. The patient in the artery with the difficulty in the breathing due to the bilateral phrenic damage. Most of the left ventricle LVB and RVBs are supplied by the LCA. The gold standard investigation for the placenta previa would be the transvaginal ultrasound, which muscle action primarily causes the short and the laterally rotated limb in the neck of the femur fracture. The Zelius was the patient presented with the pain in the right hypochondrium, nausea, and the jaundice pain is going to shoulder region and the upper back. Which condition is associated? That is the cholecystitis. The following structures show concomitant hypertrophy and hyperplasia. There is a uterus in the pregnancy. The young male having the scrotal mass and the race LDH. Probable diagnosis is which of the following? The seminoma. Next 37 the nerve damage in the submandibular gland surgery would be the lingual nerve. While doing submandibular gland surgery, following nerves must be damaged. It is very important. We must remember it. The martial-mandibular nerve, lingual, hypoglossal, and the mandibular nerve will not be damaged here in this case, which is the branch of the trigeminal nerve. So the nerve causing the lacrimation while eating is the facial nerve. The patient, the lower back band, direct examination, hilar posterior nasal edge, metastasis is by the internal iliac. After half of the liver transplant, the remaining half of the liver regeneration occurs in the 5 to 15 days. Next, 41, the female presents the weakness the legs upon CT bilaterally in the forebrain tract involved would be the cortico-spinal tract. 60-year-old man with the fatigue, weakness, and exercise intolerance, HP 9.1, fatty 9, MCV is 115. What will be seen on the histology? That is macrocytosis, DNA repair gene prevent cancer. Defective repair causes the cancer due to the gain of the mutations. The patient with the decreased neutrophils, increased lymphocytes, and increased eosinophils, increased ACTH, likely diagnosis would be the Addison's disease. Next, 45, the raised ACTH will lead to the hyperpigmentation. The patient has bilateral bilateral swelling, has the dysphagia and the oral lesions. The mechanism of autoimmune, the plasma protein drugs are related to the inactive until activated by the liver. Ear pain and the tragus develops first and the second bronchial arch. Absorption of the CSF occurs in the arachnoid villi. The Aguilar cells present in the terminal bronchi. The glucose is absorbed in the intestines through the sodium glucose co-transport. The patient with the recurrent TB infection having halal lymphnopathy with the improper granuloma formation will be raised. That is the interleukin 12 and interferon gamma. The person having the angular chiliosis and the coronary vascularization, deficiency of the riboflavin, the patient the RT having the blood loss and the develop hypovolemic shock. Histological findings in this patient's kidney will be the acute tubular necrosis, the parotid gland enlargement just on the parotid duct. What will be the cause of death of cells in this gland? That is apoptosis. Now, CCF, the patient develop pedal edema in the pleural vein and pleural tap. Done. What will be the finding of the flood suggestive of the transudate? That is a low cell count. The cutaneous lesion of the sarcoma can be easily diagnosed by the vascularity. The patient with alcoholic hepatitis, the mammary body's interwoven structure is the intermediate filament. The child presented with a dark colored nappy. The urine in the homogeneous state, oxygen deficiency. What's likely cause? It is albuminuria. The eating raw can cause infection by the tapeworm. The second heart sound is due to the isovolumetric relaxation. During which phase of the cardiac cycle, 2/3 of the ventricular filling occurs in third heart sound is produced by the rapid inflow. The patient presenting the shock with having increased heart rate, decreased BP, and the peripheral edema. That is the norepinephrine must be given. Patient the history of the fracture after they develop the crepitus, full smelling discharge with low BP. What is the cause? That is the toxemic shock. The 5-year-old child caught sore throat. The gray whitish membrane covering the throat. The diphtheria antitoxin was given as a treatment. The mechanism of action of the toxin is definitely inhibit the protein synthesis. The apex beat is located the left fifth intercostal space. The patient presented with the palpitations and having absent P waves with the irregular pulse and irregular MR interval and has a hereditary grumbling murmur. That likely is metal insufficiency. The patient has gynecomastia, tall height, and infertility karyotype shows the double X1Y. Likely diagnosis the Klinefelter. The patient with a severe headache, vomiting in the neck, stiffness raised, ICM in the lumbar puncture. The blood stain CSF diagnosis would be the subarachnoid hemorrhage. The patient after RTA resuscitated DS. Signs of successful resuscitation would be the increased urine output. The patient the multiple jar draining abscesses and granuloma. What we will see in the microscopy, the granuloma with the abscess. The student examining the staining, which was the gram positive cocci in the chain, many attempts made but can't be cultured. What techniques can be used to report from it? That is the serology. The player hiked to mountain having the low partial oxygen, developed dyspnea. The likely etiology is the hypoxia. The boy had fallen from height of 10 feet. The talus bone fracture. What will be affected? That is the medial longitudinal arch. Next, 75 after RTA to the hemorrhage. A person with the 2-liter blood loss, the blood volume restored back is by the DCT. After chemotherapy, tumor size reduced due to which mechanism? That is apoptosis. The drug used in the treatment of acute with the migraine after paracetamol ineffective would be the sumatriptan. The sulfur granules contain the actinomycetes. Ostium scandum defect is due to the failure of the endocardial cushion to fuse. A man comes and complains about the receptionist behavior while other patients and the staff have no complaint from it. Whole handle. The bulges patient talk to the receptionist. Patient active with HIV. What will be response? Immediately consult the patient and then neuroleptic analgesia is by the droperidol with the fentanyl. Edema in the liver patient is due to the decrease in cardiac pressure. The patient on the anti-rheumatic drugs develops a cutaneous manifestation due to the SLE. The patient unconscious for the 30 minutes after accident is brought to the ER. He's pale with the cold, clammy skin, pulse rapid and thread. Mean artery pressure is below 60, partial pressure is below 60. But and provide the rapid response. In this case, that is seen as ischemic response. Vasculitis that involves same vessel with the different vessel. The region of the different ages is among these the patient with the decrease of FEV1 FVC and the ratio is which of the following: the desmol platelets. Adherence factor is present on which of the following platelets? There is the cell membrane. The patient presented the semi-conscious condition with the subclavian-Steele syndrome. Blood supply to which artery is causing this syndrome? The vertebral artery. Patient developed the Miller neck swelling, which was diagnosed in thyroid nodule structure, most likely damaged during FNAC of the thyroid nodule is the inferior thyroid artery. Inferior thyroid is damaged. 91. The old man who was being treated by the GP for infection with the certain drugs coming with the compliance of generalized weakness, pallor disease, bruising, HP 5 degrees, RBC, TLC count, platelets, 30 counts 0.1. Hypocellular bone marrow with a few cells. Diagnosis would be the aplastic anemia, which is the following is function of the insulin, that is increased glycolysis. The regarding prevalence, what is true, that is the old and the new cases. The manubrosternal joint is secondary cartilaginous joint. The perinephric fat is an extension of the renal fascia. The cell produce the abnormal proteins and the fragments degraded by the proteasome. In metaplasia, if the chromosome divide transversely rather than longitudinally divide, will happen. There is the isochromosome. The person who was chronic alcoholic had the hematemesis. The damaged organ in this patient had the neoplasm, which extend to inferior surface. Blood supply to this area is from the abdominal aorta. Two, regarding the heart muscle, is the autonomic supply after bilateral salpingophorectomy and the total abdominal hysterectomy. For occurrence of the tumor, which marker is used, that is CA125. Cell raised in the prostatic infection would be the eosinophils. Biology of the drug increases if it is largely hydrophilic yet soluble in the water. The female complainant the body have the malarial rash. Her ANA is also positive, but is a likely diagnosis, that is the SLE. The patient presented the hyperglycemia, increased lymphocytes in eosinophil due to the Cushing syndrome. Which part of the brain receives the major excitatory input? Two from cerebral cortex, but it itself doesn't send axons to the cortex back, that is the substantia nigra. The sea diver after diving develops the shortness of breath and the joint pain. The cause in this case is the nitrogen bubbles in the blood. 49-year-old man has a pulmonary embolism that completely blocks blood flow to the left lung. As well, which of the following will occur, that is alveolar partial pressure of oxygen in the left lung will be the approximately equal to the partial pressure of oxygen in the inspired air. 108. The patient is hyperventilating. Group of the neurons that are inactive normally is activated in the medulla by increased breathing during the exercise, that is the ventral. The inspiratory ramp signals are produced from the dorsal respiratory neurons. Their rate increase in response to the impulses from the pneumatoxic centers in the bones. 110. The beginning of the ventricular contraction displacing the valve upward causes which wave in the JVP? The C wave. The most common complication of the third degree burn would be the scar. The interruption to the cervical sympathetic chain resulting in the ptosis, myosin, hydrosis due to the Horner syndrome. The sublingual route drug absorbed into which vein? That is the sublingual vein. The young girl finds it hard to hear at low frequencies. The sound, which type of the conduction? That is the conductive. The tumor with good prognosis and the curable is the gastric. The patient presents the shortness of breath, scratchy sound with no change in the respiration. On echocardiography, pericardial vein is noted. What is best site to remove the blood? That is subcostal with the needle angle squarely. Most significant cause of the atheroma is the diastolic hypertension. Different color perception in the cortex is due to the visual cortex. The floor of stabular fossa is formed by the ischium and the pubis. Next, 120. The antigen presenting cell which show the massive phagocytic effect is the macrophage monocytes. Cell repolarization occurs due to outward movement of the potassium 16-ol with a 15-year history of the diabetes. How to check long-term glycemic control? The definite glycosidic hemoglobin HbA1c. After injury to cortex, which supporting cell will be present? That is very good intro. Glial cells. The patient the long history of the headache with increase in the tilting forward in the yellow nasal discharge due to the chronic sensitivity. The shortest pro-erythrocytic phase is the by the Plasmodium falciparum. Next, the homocystinemia is associated with the deficiency of which vitamin? There is vitamin B12. The length of the right bronchus is the 2.5 centimeter. Which part of the intestine? Thick loop with the less mesentery fat and the long vasa recta. With her arcade, surgeon asked by uplifting of the gut during the surgery. That is the jejunum. Which of the following is connective tissue in the brain? That is the oligodendrocyte. The 16-week pregnant lady with ultrasound finding of the increase in amniotic fluid, she was advised to beta hCG, after 2 weeks alpha fetoprotein. Later on, alpha fetoprotein comes out to be raised by the likely diagnosis, that is the anencephaly. During exam preparation, the pupil dilated, eyes stay at one place for the long time, heartbeat falls due to which system that is sympathetic. The gastric HCl from the parietal cells is needed for the conversion of the pepsin into the pepsin. The patient complains of dryness of eyes. On examination, there was decreased secretion of the lacrimal gland. The nerve carrying the postganglionic fibers to the lacrimal gland is the maxillary nerve. The area from the mitral valve articulation is which of the following that the mid-clavicular line of the left fifth intercostal. The patient presented with the sore throat, some mental swelling, the testicular involvement. Her two boys has the same history. That could be the mumps. 24-year-old lady, 6 week pregnant, generalized weakness and lethargy. HP is 9.8 with the MC 58 and MCH 15. Serum ferritin level is 150. The diagnosis would be the thalassemia trait. 60-year-old man with the fatigue, weakness and exercise intolerance, hemoglobin 9.1 and the ferritin 9. Mean corpuscular volume is 120. Diagnosis is by the megaloblastic anemia. The 25-year-old man presented the complaint of the postprandial blotting, abdominal cramping. He has a history of the passing, foul smelling stool, which investigation will give us multiple information regarding the problem, that is the stool DR. Next, the patient presented with the irregular pulse, unity absent P waves and irregular RR interval, the corresponding increase firing from the atrias. The female patient was transfused the blood 3 days, becomes dyspneic and died. Most likely the cause will be the bacterial contamination of the blood. 20-year-old girl presented with the progressive pallor, easy fatigue, lethargy. Absolute lymphocytosis TLC count raised with more than 85% lymphocyte. The most likely diagnosis would be the infection mononucleus absorption of the CSF occurs in arachnoid granulations. The patient whose ECG is normal, cardiac enzymes normal, X-ray lung feel clear, but on CT scan 0.5 centimeter calcifications found and ball movement of heart waves noted, was the primary heart tumor related to this atrial myxedema. Most liable sign of the irreversible cell injury would be the massive calcium influx. The man inhaling cigarette for 6 years due to his job developed the cough. One symptom as in the X-ray was present, but cells may be seen in his lungs, that is a foreign body. Janssen, the patient having the retrosternal chest pain, nausea and GERD with velvety esophagus and the coronary epithelium will increase chance of these Barrett's esophagus. 1/7 the person is having history of the smoking and the drinking from many years. Endoscopy, there is a mass in the middle third of esophagus, but could it be squamous carcinoma? We have to remember it. The upper 2/3 would be the squamous carcinoma, lower 1/3 is the adenocarcinoma. The patient came the year the BU 160 by 100, having headache, fatigue, and the palpitations. Sodium 150, potassium 2.5. The likely cause of this condition is the hyperaldosteronism. 5-year-old child caught sore throat, the gray white membrane covering the throat. Again, that is the mechanism is inhibit protein senses. Next, the patient has the multiple visits. The far east indulges in the sexual activities comes the operative the conjunctivitis. Gram-negative diplococci was cultured organism is the Neisseria gonorrhea. The patient develops a sudden severe headache accompanying the palpitations, anxiety, and the sweating. The episode pulse was 56, potassium 3.4, excess of which hormone is there is norepinephrine. 35-year-old patient presented with a bone fracture. Lab investigation vitamin D levels were reduced, likely causes the osteoporosis. The peripheral neuropathy can due to the diabetes, but is defective. The entry cell, the woman with a history of the trauma on the head and neck region, having knee on the tongue and the protein of tongue due to the left side of the nerve, most likely injured in this case would definitely be the left hypoglossal nerve. The patient working in the mine has the repugnant test positive, present the cough, fever, weight loss, halal lymphadenopathy. The silicosis mechanism methyl dopa is alpha receptors agonist in the CNS, which antimetabolite can be used for the non-neoplastic purposes. There is azathioprine, which would be the best accurate investigation for the antepartum fetal well-being with the lowest rate of the false positive. That is the biophysical profile, which blood vessel have the valves, that is medium-sized vein. The receptors act as the transducers by increasing response to the repeated stimulus. The patient suffering from the apparent mineralocorticoid excess, what will be present in this patient, that is the hypertension. Crista galli is the extension of the which bone, that is the ethmoid. Celatoschica part of which bone, that is the sphenoid. After an automobile accident, splenectomy done. After 2 months, the patient presents to the emergency with a septic shock and the fever. Causative organism for this overwhelming infection is the strep pneumonia. The patient was taking carbamazepine, starting at the drug, and noticed the seizure episode increased. This is due to which drug, that is the phenobarbital. On lung streptococcal infection, clearance of the infection is by the HO2. The patient with the epiphora negative Jones 1, Jones 2 fluorescent test, but will be the next plan. The probing dormant staging of the malaria is the hypnocyte. The sensory preganglionic sympathetic fibers travel through the white ramus. 170, which factor should be the most important in descriptive study, that is a sex, the polysynaptic synapses is related to the cremasteric reflex bacteria skin, which help in the proliferation of new capillaries in the wound. That is the PDGF. 35-year-old female present the 6-month history of the fingers turning pale. The Raynaud's phenomena, that is gonna be HPTM TLC platelets normal, ANA positive. The antibody raised would be the anti-centromere. Once active for the patient on the warfarin therapy, which of the following dose should be adjusted? That is the cimetidine movement of the brain with the skull limited by the falx cerebri. So that's it from this video. Thanks for watching my video. Do subscribe my channel. Until my next video, Allah Hafiz.